Respected organizers, professors, good afternoon. So today I'd like to share with you two specific cases for you. So our Jiangxi Medical TR Hospital has successfully carried out the HIFU treatment and has completed more than 1,500 cases so far. The first case is aggressive fibroma. Patient, 19 years old, female, with no history of intercourse. Major complaint, right flank pain and discomfort for more than 3 months. And the patient had a right lumbago without obvious endorsement. And there is a big mass in the pelvic cavity. The admission diagnosis is pelvic aggressive fibromatosis. There are a lot of literatures on aggressive fibromatosis. The multiple MRI-guided focused ultrasound therapy can effectively control the tumor growth. This disease is hard to be cured. So what's the definition for the disease? AF is known as a desmoid fibromatosis, has a high rate of recurrence. It is highly aggressive. There are several types of this disease. One is the extra-abdominal, and second is intra-abdominal type. And intra-abdominal type is very serious because it will put pressure on the intestine and organs. And also, the symptoms can range from a painless, slow-growing mass at the site of the disease to severe pain, swelling, and deformity. This patient has conducted the treatment in Ningbo. The treatment for this kind of aggressive fibromatosis is difficult. It is hard to radically remove the aggressive fibromatosis, and 20% to 30% of recurrence rate. It is hard to remove because it intertwines with the organs in the pelvic cavity. This is the third case. And another patient has received treatment in other hospital. And this patient has been treated in our hospital. I conducted removal and excision of the fibromatosis. But it is hard to radically remove this fibromatosis because it's aggressive. It will aggressively intertwined with other organs. So the pelvic cavity is occupied by the aggressive fibromatosis. So it is difficult to treat this kind of disease. There are several ways to treat it, including radiotherapy, radiofrequency therapy. But all these have some kind of limitations. And also the estrogen or chemotherapy, but there is an absence of the best modalities for this disease. And this patient was enrolled in our hospital. And after consultation, I think HIFU treatment is suitable for this patient. So this patient was transferred to our department in April 27, 2022. And he has been treated and ablated. And on April 27, we have conducted several treatments on this patient. In 10 May, we have conducted a HIFU ablation on this patient. 1 month later, in June, ablation again, and in October again. So we have conducted 3 times ablation for these patients. So the patient is recovering. The symptom has been relieved. And if there is another symptom, we will conduct ablation for this patient again. So this case indicates the recurrence of the HIFU treatment compared with other traditional therapy. This is the first HIFU treatment, T2. This is T2 strengthened. This is interval between these 2 treatments. This is CT image. This is T2. This is May 22, 2020. And before it is solid, and at present it is vacuum. And on August 2nd, the 3rd ablation, we can see this is a vacuum in the pelvic cavity. There is another specific case, the adenomyosis. In China, we have consensus on the treatment of adenomyosis. We think the HIFU treatment is suitable for adenomyosis using the effects of head and cavity. Focus ultrasound extracorporeal into the target tissue without impairment to the surrounding tissue and removing the lesion. This is treatment of HIFU on adenomyosis. The adenomyosis with uterine dilatation and hydronephrosis. In 1990, we have conducted hysterectomy without mineral. In 2001, she went to the urinary department for treatment. 3 months later, she took out the tube. This is MRI preoperatively with serious hydronephrosis. In 2022, the left double J tube was replaced. And on June 10, the double J tube was removed. And the double J tube was replaced and installed repetitively, which impaired her function of the kidney. She went to Beijing for treatment. The function of the kidney is impaired. The renal dynamic imaging showed the blood perfusion of the left kidney was normal, and the function was slightly impaired, and the drainage of the left upper urinary tract was not smooth, and it was recommended to perform double atherectomy and partial uterectomy and bladder replantation. This surgery has a great impairment on women. This is a CT on August 4. The CT indicates the hydronephrosis and shrinkage of the kidney. This is a prescription by the first hospital of the Peking University, requiring the excision of the organs. And she came back to me, and my suggestion is to put in the double J tube with HIFU ablation with mineral 3 months later, and take out the tube and to re-examine the conditions. And in May this year, this patient was fully recovered, avoiding the impairment. This is preoperative. The other is postoperative. shows that the patient is recovered. This is a vaginal ultrasound. She has recovered. This is a post-operative color Doppler ultrasound, May 12. The left and the right kidney has fulfilled its function. We are happy to see that we have saved her uterine and appendixes. So, on the basis of the above-mentioned cases, HIFU treatment is efficient for those patients with a specific case, avoiding impairment to other organs, avoiding from uterus excision, hysterectomy, and other harms. And for specific patients, HIFU can be recurred. Thank you. That's all for my sharing.